I'm Coach Tarek, host of Purpose Driven Movement podcast and international educator, here to inform health and fitness professionals like you with the tools to create real change within the fitness industry. I've just had an amazing interview with Dr. Torkil from Norway, who's really quite an incredible perspective on not just focusing in on disease, but through his adventures and travels and photography, all those life experiences have taught him to broaden out his perspective and actually see that the medical industry in itself is stuck in disease. So in order to get out, to broaden the perspective, is to look into what we can control. A couple of things that really pop out here in this episode is being the health normalization, like thinking about the human dashboard. And the human dashboard is something accessible to us all. We've covered so much in this incredible episode, and I hope you enjoy this as much as I have. Check out the Functional Training Institute's latest offer, which is 15% off of any of our online training courses. Simply go to functionaltraininginstitute.com and input PDM15 at cart checkout. I always love interviewing different fascinating individuals across different contexts, whether it be for health, fitness, prevention, or whether they're in the trenches, such as working as an ER doctor, which is my guest, Dr. Torkil. Dr. Torkil, it's great to have you on our podcast. We have had some conversation prior to this and really got to know a lot about you, and everything that you say and do really resonates with my philosophies. Now, the audience don't want to know what I care about as much as what you have to say. So it's an honor to have you on our podcast. Welcome.
Thank you. Thank you so much, Tarek. Great to be here.
And you're all the way from Norway, which is again fascinating. We have guests on this podcast from around the world, so we love different perspectives, and your perspective in particular coming from the medical field, but also outside of that, you know, how you've become an author, a photographer, and really an adventurer with a firm mission in mind about really bringing back this idea of health normalization, which is really the topic of our conversation and which I've actually pinched from you from our conversation. Now, before we get into that, if you can let the guests know just in brief about you and your mission, because I'm sure they'd love to hear about that.
Yeah, I am a standard general practitioner doctor and the ER physician, emergency physician, working all over Norway. So I've been working from north to south in Norway, working as a freelancer, as I like to see the whole country. I like to be free. I like to travel the world. I've been doing a lot of photography, as you say. I've been traveling for 5 or 6 years all over the world. And originally I wanted to be a doctor to live this kind of a free life. But I discovered some things that were important to keep me healthy, because after my father died at 73, I decided I need to know how I can live longer than that and extend my life as much as I can, you know, within reason. So I discovered some really interesting knowledge about this that I was not taught as a physician about how we can stay healthy. And I wrote a book about it. It's called The Pulse Cure. It's about how you can use wearables like smartwatches and smart rings and so on to keep track of your lifestyle changes so that you can better monitor it. And it's been just a huge success in Norway. It's been a bestseller. It still is 2 years afterwards, translated into 8 languages. And the book is then about how you can use wearables and how you can, which lifestyle strategies are free and effective to keep you healthy. So that is the main thing about the book, really. And it's about, as you say, it's about health normalization. It's about not spending all your time on getting healthy, but enough time that your health is normal. And that doesn't take so much time as it would take to keep it optimal. And we don't even know what optimal is, but we know kind of what normal is.
Yeah, it's wonderful. Well, it's your thing, and I actually have pinched it from you. So this concept of health normalization versus optimization, and it seems like that word optimize or optimization is an overkill. It's used particularly from a health perspective, as you say, without really knowing what is optimal. So can you talk a little bit more about the key sort of metrics from a physical perspective of what will be prevalent for health normalization?
I would say that in my job, I meet sick people. That is my job, to treat sick people. They come in a row, like a parade, hitting into my office. And I have also been a photographer teaching photography classes all around the world in many different countries like Cuba, Ethiopia, Sri Lanka, Morocco, France, anywhere. So I have seen more of healthy people than most doctors do, because if you only see sick people, you think that is the normal. And if you are working a lot with healthy people, you see there is a difference. And I would say it doesn't take much to have a healthy lifestyle so that your health is not in your way. That is my definition of normalization. So your health is not in your way in your daily life, and you live as long as you are kind of meant to live. There's no disease subtracting years from your life, which would normally mean that you get into your 90s still vital, and maybe in the course of 3 or 4 or 5 years you deteriorate naturally, like you would have to. We cannot live to be 200. So after we pass 90 years old, our bodies are kind of instructed to self-destruct. That is the natural way, the normal way of health. But in my work, I see people troubled by health from their 50s, and they die 10, 15 years earlier than they could have done. And the strategies to avoid that is quite simple. It's moving enough, moving maybe an hour a day. That could be as easy as walking, and with some intense activity 2-3 times a week. Doesn't need to be more than that. Make sure that you have a certain amount of muscles, that you're able to do push-ups, squats, and such easy exercises. It would be that you would sleep 7 to 8 hours a night. It would be that you would prefer healthy food compared to ultra-processed food and, sweets and candy and such stuff. It would mean that you would minimize alcohol consumption, because alcohol is the worst stressor. And what more, it would mean that you would be able to calm your nervous system in some way, that you're able to mitigate stress by breath work or by meditation, by mindfulness, whatever strategy you have to calm yourself down, because stress is such prevalent in our society, of course. So those are some of the strategies that you would need to implement to live this healthy life. And American research actually shows that if you do these things right, you live 24 years longer than if you do these things wrong. Having good relationships, by the way, is also one of these strategies for those 24 extra years. So it's not a matter of 2 or 3 years extra to get out of life. It's a matter of decades. The research shows that. And this is what I'm showing in my book. I'm showing a summary of the best strategies to live longer, but also how this is coupled. We can show it by the heart rate, because the heart rate variability will show us if we are on the right way. Heart rate variability is like a speedometer for our health. And with the new wearables, we can measure this. And what we can measure, we can manage, of course, so much easier. So it's like getting a dashboard for your health. So in the dashboard in your car, of course, you see the speed, you see how much gas is left on the tank, what is the outside temperature. Not so important in Australia or Thailand where you are, but in Norway here, where it's now freezing temperature outside, that's interesting to know, because it will tell you how slippery the road is from ice. It was very slippery driving here yesterday. So you have this dashboard to drive safely. And now we have a dashboard to live safely, when we can see that our heart rate variability is within a healthy range. We're not pushing ourselves too hard. We can see the temperature. We can see that we are moving enough and not too much either. That is also not so good. So with these wearables, and the technology here is just exploding. It's just so many useful wearables, of which still, by the way, Garmin is by far the best one. But so many other wearables are also adding to the picture.
On the Garmin note, we'll leave a link to that lecture and perhaps your book, how someone could access your book. So folks, you can all see that in the show notes. Before we dive into this concept of the human dashboard, which I really love, I want to go back a bit. And you talked about, and I think this has struck a real chord for me over the years, thinking that like a paradigm shift here of not just trying to live the longest you possibly can, but live with quality, right? So the lifespan, perhaps the definition could be living as long as you optimally can, as pain-free or as disease-free, and then just letting nature kind of take its course, as you said, in those final years, but not, of course, notwithstanding tragedy. A lot of times it's in our hands, isn't it? And I think that's a real important point, is to think, is it simply the healthcare system wanting to expand life for the sake of it, or is it prolonging it with quality of life in mind? And you being an ER doctor, what do you often see as the main reasons why it's just simply about keeping someone alive versus thinking about the quality of life? Of course, when in an ER concept, you need to try to save a life. That's completely understandable. But then what takes course after that?
Yeah, so as a doctor, so that's another problem of the modern healthcare, that we can keep people alive for even with a very, very poor health situation. And often parents and relatives, of course you want to keep their parents alive as long as possible, and we put a lot of money into those final years, final half year for people. It probably takes away a lot of resources for what we could maybe have done in preventative healthcare. But I am not so involved in that part, because that is after when they come into their nursing homes and so on. So in the ER that I work in, we're not so much involved in that. They're not coming to us, at least not in Norway. So they're staying in their nursing homes.
Yeah, I hear you. You mentioned an important point from your journey, that it seems like you had a real perspective shift, so you got out of your routine, let's say from a professional perspective, your ER routine, being a doctor, but you having these extracurricular activities simply were for your enjoyment. Then it seemed to you at a point in time where you thought, the world needs to know, like, you need to share this. So your story wasn't just for you, but it became a we thing, an intercultural thing, which is fascinating. And I want to know a little bit more about that, because I think it's important to not just judge, let's say, doctors' mentality in general, to say all they're about is just disease, because that's the environment they're in. But if one doesn't broaden out and shift their perspective to actually see what healthy living is, then we're all in disease, right? That's the kind of mindset. So that's the first thing I wanted to mention, just to bring that up as a powerful point. But then what was that point for you, that turning point where you thought, like, the world needs to know, you need to write these books, you need to share this, like, what occurred for you?
Yeah, the first time, because I've written a book in Norwegian, it's not translated yet into English. It's called The Camera Cure, because I've been a photographer myself for many years and had been teaching 60 photographic workshops all around the world as well. And I had learned that the strategies that you need to take a good picture is the same strategies that you need to approach any problem or any opportunity. It's the same way to think and do things to succeed in whatever you want to succeed in, whether it's taking a picture or whether it's being healthy. And I also saw that coping skills is essential to life quality. And when I saw that, what I thought was doing two separate things, being a photographer and being a doctor, was really just one thing. So I could use the same strategies. So this was kind of a way to do photographic therapy, teach people how to make better choices through photography. Because the things that I was trying to tell patients in the office was often rejected. But when I taught the same things in a photography class, it was accepted. So I thought, okay, let's go through photography to teach people how to do things. And then I wrote The Camera Cure, which is also a bestseller in Norwegian. Hopefully at some times it will be released in English as well. And then after that, I started using these wearables for health tracking. And then they asked me, my publisher of The Camera Cure asked me, could this be a book for us? Because this was a completely new thing. It was something that I was doing for my own sake. And I had not really thought about the chance to get it out into the world. But it seemed, to hit the ground at a good time in Norway, because it just exploded, being the third most sold book in Norway the first year. And even the second year, it has been the 15th most sold book in Norway, 2 years after it was released. And it's still very popular, still so much happening. So it has changed my stress balance, that's for sure, and changed my life, because I used to be just a normal doctor treating people one-on-one. And now I'm all over the press, all over the TV, media, anywhere. So it's a new life for me as well. So I really need to be able to calm down my nervous system and keep the balance.
Keeping humbly grounded. That's what it seems to me. Now, thank you for sharing. That's powerful. As the quote or the saying goes, a picture paints 1,000 words. So I think it's really spot on that we have models for people that don't just think intellectually or activate one side of the brain, but also it's pictorial or metaphorical. And so I think there's something to be said about the way that we relay knowledge need not be one-dimensionally or dimensional. Now, let's shift to the human dashboard, because again, that's a kind of thing that I'm pinching from you as well. This I love it, the human dashboard, because I myself in my practice, I have 5 personal health metrics, if you will. That's for physically and psychologically. And as I was going through these I review my whole week, usually on a Saturday morning, which I did at the coffee shop with my partner and planned away with some good creative space. So mine is learning a language. So I aim to tick that off. And then I go for lung volume test and training. So I do a lung volume. So I use the Aerofit, which I really love at the moment. And then I have a morning flow. So I spend at least half an hour to meditate, stretch, breath work. And in the evening, I'll slow down, get into parasympathetic. So I'll do a different breath work. I'll journal and just give gratitude as I can and so forth. And then training is important to me. And I break my training up personally into sometimes 15 minutes, 20 minutes, but usually 3 times in the day. But they're my metrics, right? So what I do doesn't work necessarily for everyone. So that's kind of like my dashboard. I have some degree of visibility on the tracking. And I also love to still write, and I've got my pen in my hand. And so I use both. And that for me keeps me grounded and focused, knowing that these are important things, because it's all the little things that really add up. And you alluded to this earlier. We can have a sudden crisis all of a sudden, like my oldest brother did many years ago, on the verge of a heart attack. And that was like, well, then there was this reliance just on the medical, like medications. There's a time and place for that, but phasing out and then stopping training, like getting into a flow, a rhythm where, hey, we know these are good things, but they have to be done consistently. And I think to your point here, what I want to stress is that having it seen on some form of a dashboard is really important. So let's focus in on the human dashboard and understanding, what do you think we need to be privy to or see? So you talked about heart rate variability. What else do you feel needs to be tracked and seen?
It would be the amount of exercise every day that you would get, the number of minutes of intense activity that you will get throughout the day is good to keep track of. This is what I do. Also, your sleep quality, that you can see and measure your sleep quality and make sure it's good enough on most of the days. Not necessarily every day. If you do 80% of your days within a good way, you can have 20% of your days that is too much or activity or too low activity. So get most of the days, at a good level of activity and sleep and so on. So I would say that if you get the heart rate variability right, because the wonder is that the heart rate can tell us so much about the state of our whole physiology, the state of our autonomic nervous system, whether we have a good balance between the parasympathetic mode and the sympathetic mode. That we can see by watching heart rate variability. And the heart rate, we are not really equipped to feel that. It has been muted, our sense of feeling our stress levels. Right now, as we talk, I would not know if I have 60 or 80 or 85 in heart rate. I don't feel that. If that noise from our inner system would be tangible, it would historically disturb the senses to the outward world, where all the threats came from. All the threats came from other animals, from enemies, from food that was, foul, and so on. We have excellent sense of smell. We could smell the fire, far, far away. And we can actually smell water. We can smell how the earth combined with water. We have an extra good sense of that smell. But now the trouble is not from the outside, it's from the inside. It's from too much stress on our system from so many sources. And that is what is making us sick now, these days. And we don't have the equipment, the senses to feel that. So these wearables is like a substitute for that sense that we never needed to develop. Because if you do something bad for your health, like drinking alcohol or smoking or eating food that you're not supposed to, your heart rate goes up without you knowing it. But the trackers will see that if I eat candy or chocolate, it will give me stress. It will ruin my sleep throughout the night if I eat that late at night, for example. And I would not be aware of that. So the heart rate variability is by far the most important. It's kind of the speed, the most important thing on your dashboard. And then the sleep quality, that will be measured by your sleep phases, how restful you are sleeping. It will measure your rate of breath per minute also. So in this way, the wearables keep track of your health while you're busy living your life or sleeping. They have control 24 hours of your physiology. The heart rate variability is also a measure not only of the autonomic nervous system, but also of your mitochondrial function. So if your health is at a poor level, if you have a low VO2 max, which they can also track. That would also be an important number on your dashboard, your VO2 max, really, really important. And that will show you if your whole system is running smoothly. If you have a good heart rate variability, if you have a good VO2 max, then you have a good capacity. You can do the same work at a lower RPM, so to speak. Your engine is running more easily than if you have a poor VO2 max and any activity demands too much forces of you. So VO2 max is really important. And it shows the state of your mitochondria, that you have good cells. If you have good cells in your body, you have good organs and your whole physiology works better.
What do you think with regards to people tracking their dashboard? What are some of the barriers, obstacles that maybe you've come across or that you can maybe flag for people? Is it just a simple thing of habit, but can you go into maybe some nuances around what potentially are barriers for people to adopt this?
I would say, I'm not sure exactly what you mean, but what I can see and what people see when they start tracking your system. Again, this is only by the Garmin watches where you can kind of micromanage your stress levels in this way. Then you will see that the main obstacles for good stress levels, that is alcohol. That is the worst one. Also according to Whoop, which is also a very good wearable. According to Whoop, who collects the data from their customers, they will see that alcohol is the worst stressor of all, more than disease actually. And you would see that late meals is a stressor. Your sleep will be worse after a late meal. So most people will learn that they should stop eating the last meal maybe 3 or 4 hours before they go to bed. They would also see that fasting is good, that fasting calms down their system. They would see that late night training is destructive for their sleep. They will be able to see how intense and how much exercise should they do to be inside a good stress level, because a lot of people, they exercise too much compared to their overall stress levels at the time. It's kind of, you have a certain body budget, a certain amount of energy that you can put into work, family life, exercise, and you need to make it, the budget goes up. So these are some of the things that you will find out as you start wearing it, if that is what you meant.
Yeah, kind of. I think perhaps I didn't make it too clear. It was more around having a device that could actually make it easy and accessible, because the easy entry point into habit formation is to make it easy, make it visible, and creating less barriers, because you and I will be motivated to do this, but other people may not have that sort of motivation, right?
And the visualization of this makes it so much easier for people. When you see the effect of a glass of alcohol measured in real numbers that you can see, and it's easier to also feel it once you see it actually, then it becomes easier to skip that unnecessary glass of wine or so, and maybe to keep the kind of necessary glasses at a wedding or whatever special occasion. It becomes easier to do the cold plunge because that is, uncomfortable. When you see the effect of your nervous system in the hours afterwards, it becomes easier to do that. So seeing the result in real time of your choices makes it so much easier to do them, because you get the reward of your efforts straight away instead of sometimes a lot later, so that it becomes like a gamification of your health. So we're used to playing games, where you have an avatar and what you do is, the life and death of the avatar. But here it's about your own health, your own life, and at stake in a kind of a game that you can see. Earlier, people used to brag about, okay, I only sleep 5 hours a night and so on. Now you brag about, okay, I hit 90 on the sleep score tonight. So it becomes more of that. And the Garmin has this body battery system, really, really genius, that you can see in the morning your body battery so that you know an estimate of your available physiological forces that day. And you can see as it goes down, and you will try to end the night and the evening with not less than 20 in body battery. So it's almost like on the Apple Watch, you want to have the battery within 20 to 80, So it's almost like that in your physiological forces as well. So, of course, to see that and to have some knowledge into the body battery, which is now a household concept in Norway. Everybody knows that you can track your body battery, which they didn't know before the Pulse Care, that this is a way to communicate around it. People are sitting around the lunch table, what happened to your body battery, and they will exchange experiences on how to stay healthy. So I think that is a huge part of the success of the book, that it becomes something that people talk about.
Yeah, everyday vernacular. That's quite incredible. That shifting the notion of being tough because, you had a little bit of sleep, and a lot of attitudes have changed over the years, haven't they? Institutionally and individually. And as you say, it props up conversation in daily life. And the other point I will make is that it seems fairly non-invasive. It doesn't bother one, I think, as well.
Yeah, it's just something that keeps track of your heart rate, which is, it was in the ancient doctors, 2,000, 3,000 years ago in India, in Iran, in Egypt, in China, or Greece, they knew that the pulse could tell the doctor so much about the state of their patient. They didn't have access to so many metrics, They had access to the pulse, to the breath, and it can tell us so much. And where they have to put their fingers on, on their patients, now the watches are there all the time, and they're using artificial intelligence and big data to collect so much information that they can also interpret what they find by this device and give it to you in an understandable, manageable way, which you can be accountable for your own health. It gives you actionable data that you can use to lead your life in a better direction.
And then, as you said on our previous chat, what's the alternative, to not having this or making sense of data? Then it could be back in that disease loop. We want to exit that wheel of continual disease.
Absolutely. And so much disease these days, I'm probably sure it's the same in Australia and many other places, that people are burning out. They're fatigued. They're getting symptoms of stress, of brain fog, problems concentrating. They're getting into a burnout situation, at least so many people in Norway. And these wearables would warn you months and weeks before you would get into a burnout situation where you need to be on a sick leave, that you are overcharging yourself. You are really overtaxing yourself. You need to slow down. That is maybe the most important, to keep people, and particularly women, kind of hitting that wall and getting burned out and fatigued. It's probably a problem where you live as well.
Anywhere, I'd say, it's that kind of understanding the upregulation through data, or then even getting an intuitive sense of that ramping up or the upregulation. But it's, as you say, getting back to normalization or that set point is so vital, and this data will help us to do that, which is great. Just in closing, is there anything else you'd like to share about this topic that you have?
We haven't talked about the menstrual cycle. Of course, we are men, so we don't often think about that. But what do you see when you start tracking the system? And I get so many from Instagram and so many messages from women that it's so useful for them to be able to see the stress the week before menstruation, the PMS period. When they see that visualized in the heart rate variability, then it's easier to mitigate the stress in that week and get through that week without the PMS symptoms. And that is so important for that part of the population, of course, the female in their menstrual fertile period of their life. So that is really good, because you can see the PMS symptoms of irritability and fatigue is not just a sensation. It's not just a mood or a feeling. It's a physiological load on their system. You can clearly see the downshift in the heart rate variability, and it's as deep as having COVID. When I see a powerful COVID infection on people, they have the same downshift in the heart rate variability as in the week in PMS week before menstruation. So many women then have a situation where they have like a COVID infection a week every month. And the good thing is not unavoidable. With stress mitigation, taking care to sleep better, avoid the cravings of getting chocolate that would just further deteriorate your stress levels, staying away from the glass of alcohol, and being able to maybe meditate more or do yoga instead of an exercise for that week. That is really, really good for women.
It's a really wonderful point, yeah. And even for those who are coaches out there who are training women to be aware of this as well, because we get a lot of professionals that deal in the health and fitness space.
Yeah, and I would also say that the coaches, I think when I see the graphs, I think that coaches should be really aware of the VO2 max of their clients. Because if you have a low VO2 max, the level of intensity you can have in your activity is really surprisingly low. So if you have a VO2 max of 30, like so many people, at this time of year in January, would want to change their life, they may have a VO2 max of 30. They can tolerate so little exercise before their body goes into too much lactic acid. They will feel the inflammation from that exercise for days. And this inflammation that you will see in heart rate variability is also a measure of inflammation. Then you will see that after a quite easy activity, a person with a VO2 max of 30 can have days of inflammation in their systems, and they will feel that. It will feel like they are having a flu. And of course, it will demotivate them in the long run. I think that coaches and personal trainers should really know the VO2 max of their clients and adjust intensity accordingly.
Totally agree. Yeah, work in different gears shift, and that's to do with your workload or work capacity. Sensational. Yeah, this is just a trove of knowledge here and wisdom that we can access. Well, I'd like to ask guests on this question. So if you could change one thing about maybe the psyche or the lack of uptake from either a professional perspective or just what you've seen in your life in the health industry, what would it be? So if there's one thing that you'd love to see shifted in the health medical industry, what would that be?
That would be to change the focus from treating people after they get sick to preventing that they get sick in the first place. And we now know so much about what it is. It's cheap, it's free, these strategies. It's just a matter of educating people that they have this power of their health. Because most people think that, the same as I was taught as a doctor, that disease either hits you because of the genetics or just bad luck. Now we know that you have the key to avoid getting sick. And for the healthcare system to focus on that instead of treating disease, or doing both, of course, but to try to help people avoid getting sick, that would be the major shift. And these wearables is a big part of that, because it's like taking the power from the healthcare system and the doctors and the other practitioners into your own hands so that you have control. So that it's not like when you come into your doctor every third month or so and get maybe numbers and results that you don't really understand. And this is giving you numbers that you can understand and you have access to 24/7. So this is actually quite big shift, both in time of when the intervention comes and who has the power of it. I think this is a major key for a change in the healthcare.
Big time, yeah. And then I suppose the more the general population are empowered with preventative measures or cures, it's sort of like the doctors or that industry needs to sort of keep up, right? If it's focused purely on mitigating disease.
Yeah, I'm gonna say the first. I start the pulse cure with a quote from Albert Schweitzer. He was a doctor in the 1850s or so, working a lot in Africa in those environments. And he said that the doctor of the future will be oneself. And now, with information, with these wearables, with artificial intelligence that can give you answers. I know that many people use the results that they can see this, they put it into ChatGPT and get answers back. What should I do? These are my numbers. This is my VO2 max. This is what happens when I do this and that. Okay, how should I regulate this? So I think it's a bright future for this.
Yeah. And the more people do that, it's the machine learning. It'll make greater sense. That's a great quote. And the other one is the prevention is better than the cure. So I think there's a lot that listeners can take away from this conversation. The normalization, the human dashboard, and really getting into those specific metrics that one can track, let's say through Garmin, for example. We'll put the links in as well for this episode, whereby people can explore more about yourself, Torkil, and maybe access the any resources that are accessible for them. And of course, maybe check out your book as well. So there'll be plenty in the show notes for the listeners. But I think, this is so much loaded into 40 odd minutes of a great conversation that I always love these chats because, it enriches me too, and hopefully the listeners to then take action on certain areas. Perhaps we've been sitting on them almost like trying to lay that egg. And when that golden egg does come, it's like it does really make a big difference in one's life. And I'm continually learning more about myself, what makes me healthier, both mentally and physically, and also spiritually too. Because I think in the end, all of that is interconnected. But when we have these disruptions, that unexpected things, whether it's grievances, loss of someone, or a tragedy, an accident, that we become more resilient, don't we? We become more resilient in body, mind, and spirit. And I just love that and hope that as well, that these listeners can take away that it's a consistency of really taking those actions. And then, as you said earlier, really taking control of one's own destiny in a sense, and taking ownership of that, and then accessing, as you say, this great time that we have. It's all of the negativity of the news, if you will, of this thing emerging, the disease. I think, again, that often can sidetrack people, but not focusing on that and making ourselves a lot more resilient is really crucial, in my opinion.
Yeah, absolutely. And that resilience would be shown in your heart rate variability. That's the beauty of it, that it becomes measurable. And I would also say that the book is an audible also. So many people would like rather to listen to a book than reading it. So I just want to mention that. So
perfect. Yeah, I do both. I love both options, especially when I'm driving or I have this time where it's kind of wasted, quote unquote. But this is brilliant, Torkil. Thank you for your time, and we hope to stay in touch with you. And yeah, we appreciate it. I appreciate it, and keep well.
Thank you, Terry.
If you enjoyed this episode, could you do me a quick favor? If you're listening on Spotify or Apple Podcasts, could you please add your 5-star rating? Doing this really does support the show and gets our episodes in front of listeners just like yourself. Thanks for your support. I greatly appreciate it.